Hi, I am RAFAEL NAVIA, clinical psychologist. I'm going to present to you a very simple technique to reduce anxiety for situations of self-survival. I live in Finland where I taught psychotherapy and general psychology. Also, I work as a clinical psychologist in different mental health centers for 15 years. And it was at that time that I developed the CION-EMO theory, when I tend the case of patients who present the feeling of envy when she works and when she does not. This dilemma motivated me for the development of the CION-EMO theory. Currently, I'm a professor at the Technical University of Manabí, where I teach psychotherapy and psychopathology. My purpose in making this video is in some way to help people to use CION-EMO technique to reduce the anxiety and fear with the situation we are currently experiencing with the COVID-19. CION-EMO is a research work of many years that has been summarized to be used in the simple possible way, proving being effective in the clinical field for 3 decades. I recommend to put it into practice since it's the only way to know its positive effect. Now I will proceed to explain it. The technique how to reduce anxiety in survival situations is a very simple technique. It's made up of 3 parts. The first is the self-object. You only have to imagine yourself in time and space. That is, you imagine yourself, you feel your whole body in the place you are. Second, look for the object that caused the problem. In this case, the COVID-19 is the object that caused you the anxiety. And you imagine it as you think the virus is. And third, you add the helping words. They are not positive words or phrases, but they must be realistic to the situation, but as understandable as possible, so as not to put pressure on the emotional region. Words that should not be used with a technique are such as I have, I must, I want, I said, I can, among others. You should continue to create your own helping words that you consider appropriate, following CION-EMO logic. You needed to use the same helping word, especially the one you think that help you the most, since they may not be easy to create many. So, to use the technique, you will have to imagine yourself plus the COVID-19 and repeat the helping words. All these at the same time, in the best way that you can achieve it. Example of helping word. Worrying doesn't help me. Thinking too much what is going to happen will not help me. Anxiety can lower my defenses. If I am anxious, I cannot help myself or my loved one. Worry that I'm going to get infected with the COVID-19 doesn't help me. Among another thought could be I'm going to die from COVID-19. So once again, you will imagine yourself in time and space together with the COVID-19 and then the helping word. You will do this all simultaneously. You can say as helping words, worrying too much doesn't help me to survive. Watching or listening to unofficial news doesn't help me. Worry that I'm going to die just makes me anxious. Otherwise, if I can be calm, relaxed, I will have a better attitude to face the situation, what could be more useful to those around me. However, if you are anxious when imagining the object of fear of anxiety, you do not have to imagine it clearly, although eventually you have to do it so that the technique works in its entirety. If you only use the helping word and not together with the object, do not will generate the expected effect. You can practice the technique with the eyes closed or with the eyes open. And with the practice, you can do it anywhere or anytime, or when you have the skill. This technique should be practiced when the level of the anxiety is not very high, because it will be easy to do it. As well, when the anxiety is high, if the person can or have the skill. It should be used as many times as you want per day and for as long as you want, from a few seconds to a few minutes. The more you practice, the effect will be better in reducing the anxiety more and more. The method must continue to be practiced as long as it does not tire you and you feel that it helps you. If this does not happen, you are not using the objects in the proper manner, or the helping words are not understandable, or do not follow the instruction fully. And in the last of the case, the problem passed to the interpersonal level. The survival technique is only used in fear and anxiety, with problems related to survival situations. When there is a disorder or conflict with other people, it is necessary to work with the social audience, and that requires more time and the direction of CION-EMO therapy. Until next time.